that neat? When you start to see people with Alzheimer's and dementia, you see their closest connections becoming their most hurtful connections. You'll see, you go and visit those people with dementia and they'll be very kind to the people that aren't close to them in the home. But the people that are immediately in the home, they become more and more disenchanted with and more rueful. Okay? We need to look again then, how do we work with this? Prevention first. Once we have it, keep it from getting worse. Keep that person moving. Feed their brain. And especially feed them medium-chain triglycerides, and then reduce the inflammation associated with it. We've talked before about the importance of methylation and methyl groups. Let's look at this, and then also the recyclers for the brain that are the strong antioxidants. The strong antioxidants for the brain, starting, this is for you. Remember we talked about this, glutathione. So we look at S-acetyl or Oxicell. It comes in a cream. I like that one a lot because it bypasses the liver. But we can increase glutathione levels for the brain. Very, very strong antioxidant. Very, very brain protective. Okay. Tri-methyl glycine, TMG, is very, very beneficial to brain. And SAMe can actually feed the brain and help to protect it, but also has been proven in the research to improve mood. So a lot of times when you see Alzheimer's and dementia, you'll start to see that mood and effect going down. The nice thing about SAMe is it actually can bring up that mood, brighten the mood again. Okay, so very important, these two, with a combination of glutathione.
Are any of these in food, or do you have to take it as a supplement?
You need to use these as supplement because you need them to come in high enough dosing that it actually will feed the brain. Okay, so we're looking at dosing higher than just, oh yeah, I found it in some broccoli, and yeah, I found it in some kale. Those are good things again, but not enough, and especially when the glutathione system is breaking down in the liver, right? What's the number one cause of non-alcoholic fatty cirrhosis of the liver?
Is it celiac? Celiac
disease, right? Celiac disease also commonly leads to this type of a brain demise, right? Will mimic many things in the brain, including MS, right? I don't know why they're calling on your phone, probably because mine isn't ringing. Thanks for keeping that on for me. I'll call them back in a minute. Next thing that we look at are the methyl donors, and trimethylglycine is one of those. I like a product right now called Methyl Protect from Zymogen. I also like another one called Methyl SP from a company called Apex. These methyl donors, methylation is the key to the start sequencing of our proteins, our neuropeptides, and our hormones. And so when we see that there's a lack of methylation in the liver, and we see a lack of sequencing to the brain for neurotransmitters, please.
What do you mean by a lack of methylation?
Methylation. So what happens often is we lack the trimethylglycine, the B12, and the folic acid, and then the other donors that actually aid in, I'll just use the phrase locomotion. So all of our neuropeptides start, in essence, with a little engine, and then the cars all have to line up behind that little engine to be able to form proteins or neuropeptides for the brain. And a lot of times what is lacking is the little engine or start sequence, and that's a methylation process. Okay? Every amino acid begins with these methyl donors, and this is the little locomotive or start sequence that is often missing in the body. Okay? Why is that? Because if you look physiologically, B12 is absorbed in the distal portion of the small intestine. It requires, though, a hormone called intrinsic factor to be released from the stomach. Intrinsic factor, though, is only released if we have enough hydrochloric acid. And how many people in our nation take a stomach acid suppressor, which now inhibits the release of this enzyme or hormone, intrinsic factor, to be able to be activated in the small intestine very far down in the ileum, just before the ileocecal valve. So the ileum dumps into the cecum, and down there, that distal portion of the ileum is where B12 is actually absorbed. Why are we missing that? Because we can't even absorb B12. And so we really need these methyl donors. All right? And fascinating, isn't it? And, again, when we look from a functional medicine perspective, we really need to go back to the physiology, which is the function of the body, to understand and begin to comprehend what's going on with the brain, which begins way south, way below the skull, even in the gut. All right? So you are what you eat, and you are what you do. We are what we take in. Everything goes back to allowing that brain to function more optimally. Okay, please.
Sorry, the glutathione, is that oral or topical?
Yes. The answer is yes. Okay? Because glutathione, I like it in a cream form that's a topical. The topical is called Oxicell, and it's high in superoxide dismutase and glutathione. It's a transdermal delivery, which means it's going to bypass the liver because glutathione is essential for detoxifying the body in what's called phase 2 detoxification processes. So it actually helps to pull the sludge out of the blood. And if it goes through the liver will take as much of it as it can. So often when you take an oral supplement, that has to be absorbed into the bloodstream. And where's the major filter that it has to go before it can even get back to brain? The great big liver. Right? So oftentimes we'll use a transdermal delivery as a means of being able to kick that in even faster. Okay? What else is essential then for the frontal lobes of the brain? Oxygen. Okay? Breathing. And sleep apnea often leads to hypertension, weight gain, and frontal lobe demise. So when you know that your loved one is snoring, and then you hear them rattling and trying to fight and gasp for breath during the night, they're in a hypoxic state for their brain. What happens to the brain without oxygen? Slowly slowing down. So we want to keep that brain oxygenated. And Dr. Hatch and I have a goal now to actually bring in hyperbaric oxygen. So we're wanting to bring in hyperbaric oxygen to start to help people to get oxygen to their brain again. Look up hyperbaric oxygen therapy, HBOT. Hyperbaric oxygen therapy. Okay? It is amazing what we're seeing results with brain injury, brain demise, post-stroke treatment, traumatic brain injuries, brain development, developmental delays. Oxygen and hyperbaric oxygen therapy is really, from a functional medicine perspective, the next place that we need to go. And that's, Dr. Hatch and I are looking at getting that for us. The other thing is with glutathione, if you go to brainrecovery.com, the work of Dr. David Perlmutter, brainrecovery.com, you'll actually see video examples of Dr. Perlmutter giving injections of glutathione in people with Parkinsonism who walk like this and their heads are down. He'll give them an injection of glutathione, and 20 minutes later, walking just as normal as can be, forward and backward. One guy even has a little skip after he was walking with that wooden soldier gait and can hardly even turn. It's absolutely fascinating. And eventually that's something that we want to be able to offer for our patients as well, because again, an injectable glutathione works even faster. We're using things that are sustainable now, and it's amazing. Okay? Remember, for brain, we've talked about other antioxidants and other healers of the brain: N-acetylcysteine, acetyl-L-carnitine, alpha-ketoglutarate, right? All of those are very, very important. And we have those in another product, was that NeuroPTX, okay? Another product from a company called Apex. It has all of those brain protective neurotransmitter formers or precursors in a product called NeuroPTX. Acetyl-L-carnitine, N-acetylcysteine, alpha-ketoglutarate, also important for liver function and activation and feeding of the brain. So those are some real keys for us.
Those are all in that NeuroPTX.
NeuroPTX, yeah. And again, strong methyl donors for start sequencing of our neuropeptides, our neuroproteins, and also for all of our proteins and enzymes, including then our hormones. All right, so very, very important. And again, emphasis. Ask yourself, what have I done to feed my brain today? All right, because again, an ounce of prevention is worth more than a pound of cure when it comes to brain. All right, so that's good. Thank you. Anybody have a